are required to meet. As you saw, there's lots of different plans in the marketplace. Is there a minimum standard? We saw the case of Bill up here in one of the slides. Bill makes $30,000 a year. He's going to be able to get a plan. Is he going to be guaranteed some kind of minimum coverage?
Correct. And are those correct? Oh.
The answer, while she's turning her mic on, is yes, there is a minimum coverage.
Yeah, I would
And-
say what I tried to cover, there was a slide that talked about all the essential health benefits from prescription drug coverage, mental health, substance abuse, emergency services. That was that list of the essential health benefits that will be part of all the plans.
all the plans,
And
except
Joe
for
certainly is an
yeah.
expert on this and
Joe.
can elaborate.
There are 10 different categories, and those will be required both on the plans that are being sold at Connect for Health, but also any plans that are outside, that are in the regular insurance market. But some of those are ER services, hospital services, preventive services, rehabilitation, habilitation. So there are 10 different categories, and those can be found on our website if you need them.
Thank you. Next question. Will premiums be higher for a person with a pre-existing condition? No. That's one of the benefits of the Affordable Care Act. Next question. I love this question because it just shows a lot of the misinformation that's out there. Why did Congress, House and Senate, exclude itself from Obamacare after including House and Senate members in the law signed by the President? First of all, let me tell you, the House and Senate are not excluded from Obamacare, and in fact, it's interesting because most employers who have insurance no employers who have insurance right now are being forced to go into Obamacare except Congress. So in other words, if you work for an employer right now who gives you health insurance, you're not required to go into the exchange. But Congress said, if it's good enough for America, it's good enough for us. So we and our personal staffs will all be required to go into the exchanges.
Waivers and subsidies.
No, like all, thank you for asking that question because another card said that, is if you work for a big employer and they give you an insurance plan, then many times your employer pays for that plan. In fact, on the exchange, the small employers who are buying insurance for their employees, they pay premium support. And the federal government does pay that right now for its employees as one of their employment benefits. We will continue to get that. It's nothing addition, it's a continuation of what we've had before. So we will be in the exchange.
The subsidies, which were mandated
Okay.
by the Office of Personnel Management for congressional staff, are indeed illegal because that
Ma'am.
affords to the
Okay,
taxpayer.
ma'am, I'm going to try to get through as many of these questions as I can, and we can talk about that later, but I'll be going into the exchange starting January 1st. The next question is, some doctors and clinics are not accepting new patients on Medicare or Medicaid. Are they allowed to do this? This is not a problem with Obamacare. This is a problem with our healthcare system that we have had for quite some time. And the problem that we have is that we don't have enough, there's two problems. Number one, we don't have enough healthcare personnel, doctors, nurses, and so on. And number two, because of the Medicare reimbursement rates for the physicians, a lot of physicians have refused to take new patients. And this is one thing that I've really been trying to work on with my position on the House Energy and Commerce Committee, is getting some resources to pay for graduate medical education so that we can get new doctors and medical personnel into the system. But the other thing that we need to do is we need to have, this is kind of going into the weeds a little bit, but in the 1996 Budget Reconciliation Act, they had these mandatory cuts for physician reimbursement that accelerated over time. And this is one of the reasons doctors haven't wanted to take new Medicare patients. Every year, Congress does a Band-Aid kind of patch on that, and a lot of doctors say, you know, I'd like to take these patients, but I can't afford to treat them, and the one-year extensions aren't good enough. So just a couple of months ago, before the August recess, my committee actually passed a bill, bipartisan, Democrats and Republicans. We passed it unanimously, fixing this Medicare physician reimbursement issue. And we hope that it'll go through the House in general and pass through the Senate, because we think that would give some certainty for what the reimbursement is going to be, and maybe that would help. Let me just try to run through as many of these questions as I can. Did you want to make an addition to that?
I was going to make an
Yeah,
addition to
yeah,
that. Just,
go ahead.
so there's been a lot of work in Colorado working to recruit more physicians into the Medicaid program. Over last year, we've grown 6,000 additional providers willing to take Medicaid. So this is work that we're continuing both through this, and then part of the Affordable Care Act was to increase reimbursement to primary care doctors. So that started on January 1st. So they're getting 100% of the Medicare rate for the next 2 years. So that we're doing a lot to make sure that when people get an insurance card, that actually they can go someplace to get that coverage.
Thank you. Here's the next question. My friends are skeptical it's going to work and it will cost more. They are from 53 to 65 years old and can't get Medicare and have all retired. And I'm going to be frank about this because, number one, if they don't have insurance right now, before the exchange, and maybe some of you want to add on to this, but before we had the exchanges, somebody who's from 53 to 65 years old would have to go into the individual market and buy a health insurance policy, which for people our age, for people in that age bracket, is wildly expensive. And that's why a lot of seniors haven't been able to get health insurance. With the exchanges now, they're going to be able to get much more affordable rates because they'll be in a pool of people. Does anyone else want to add to that?
Yeah, I can just add, is this working?
You just have to just be a little bit
Okay,
louder.
I'll just add that one of the insurance reforms that went into effect that we haven't touched on too much yet is there is now closer age bands, so that it's a 3-to-1 ratio where someone who is more in that 60-year-old range will only have to pay 3 times the amount that, let's say, a 20-year-old would pay for a plan.
Right,
So they
can't make such a big.
Yeah, so that, do you want to add to that?
I would
too,
just
Jim?
add real quickly. For that age group also, pre-existing conditions are often the reason they can't get insurance, because as we age, we tend to develop these lovely things. So now they cannot be denied coverage due to pre-existing conditions, and that will make a huge, because it is true, that group of the uninsured has had severe problems in trying to get coverage due to not serious conditions, but things that we just get old.
Thank you. Let me just say one more thing from a personal standpoint about this age group, 53 to 65 years old. A lot of these folks have had a double whammy because with the downturn in the economy, they've lost their jobs, they can't find another job, and then they lose their insurance. One of the things I advocated for when this bill passed through the House was to allow people in that age group to buy into Medicare if they want to, so that they could at least get some insurance. You know, Medicare is it's the most popular government program we have, and it's also very efficient financially. Unfortunately, when the bill went through the Senate, they didn't put that in, but I still think, depending on how these exchanges work, from my perspective, that might be a really cost-effective and care-effective way to give insurance to that age group. Okay, next question. There's a couple of questions on this card. Number one, describe the tax penalties for the remaining uninsured. Someone talk about the tax penalties.
All right, yes, so there is starting in your 2015 tax return, if you don't have insurance and you fall in that category of folks who are required, it will be part of your taxes when you reconcile that. So in the first year, it's $95 or 9% of your income, whichever is greater. And then from there, it continues to go up. Now, you have to remember there are a huge group of folks who are exempt from having to purchase insurance. So if it costs too much, more than your household can afford, there's a hardship exemption, there's a religious exemption, and also for our American Indian Alaska Natives, they are not required to purchase insurance as well. So there is a list of folks who will fall outside of that mandate.
The second question is, can small businesses offer untaxed compensation and let employees shop on the exchange with that?
It's my understanding that any wages that will go toward healthcare as a bonus or a raise will be taxed. So I don't think that that is the greatest answer for a business to go forward, because the business will be taxed and the employee will be taxed as well.
Okay, the third question, does the ACA require voter registration info along with health registration, and will you offer that? It does not require voter information registration. I don't know if this questioner is trying to ask will it allow people to register to vote when they register for these plans, and I don't know the answer to that.
I would say that we're helping people, if they want to register, to link to that and find information. So that's what we're doing.
Okay. Here's somebody who wants to know the difference between the rent and heat rebate versus the health insurance rebate. Do you want to clarify that question?
Leap is not the same as.
Can you speak up? I can't hear you.
Or if you have low income or affordable housing.
The light heat?
The heat,
Okay, the light heat, yeah.
okay, for the heat, we are excluded because we have a energy efficient
Mike's
building.
not working.
How about that?
There, that's it.
Okay.
So, should
Yeah, go.
we have a low income building that is heat efficient, the green, okay? So we do not qualify for LEAP. But I am told that we qualify for the rent or heat rebate, which is supposed to be different than LEAP. Can you explain or clarify either one of those?
I don't really know this issue, but if you give Andrea right there your phone number, we will check it out and get back to you. Next question. My 30-year-old daughter is type 1 diabetic. She got the insurance card in August, and she has not been able to find a doctor that will take her as a new patient. What's up? And I don't know who wrote this, but I can empathize with you because my 19-year-old is a type 1 diabetic. And I think it's probably the same kinds of issues that we were just talking about with access to doctors.
Is it private insurance or?
Is it private insurance or public? Public insurance?
She just got the card from the pre-existing condition.
Okay. Does she have private health insurance?
She's been on the Colorado.
Okay.
Yeah.
Well, you know what?
I'll follow
I've
up.
got your information right here, and so we can follow up with you, and if I need to make a phone call, I will, because I know those diabetes providers. Okay, yeah, here's another question, and some folks wrote questions, and they didn't put their name on here. And if you did write these questions and you didn't put your name, and you need specific information, we can have my caseworkers follow up on this, but I can't do it if I don't have your name. And this might be a good opportunity for my staff to please stand up and let me recognize you. These are all my wonderful staff. Stephanie's here now too. They work hard for you every day. My office is down at 600 Grant Street, Suite 202, and they're there every day. We also, of course, have our website and our phone number, And much of what they do is casework. In fact, I was just at a meeting before this meeting, and a woman came up to me and said that her son was in the VA, and he got very, very sick, and he needed medical care outside of the VA, and my staff was able to get him, I don't know if that was you, Arsena, but congratulations, she doesn't know about this. So she was able to get him the help that he needed so he could get that medical care. That's the kind of thing they do every day, and if you have issues like this, you should call my office. This individual writes, a friend of mine is 75 and on Medicare. Prior to this year, she paid $47 a month for her 2 eye medicine prescriptions. This year, she's paying $503 a month for the same prescription. How is this system better for seniors? And, you know, I can't opine on that because I can't opine on that particular issue because with the closing of the donut hole, people should be paying less for their prescriptions. But it could be, I had this situation happen personally with some prescriptions I had where the prescriptions they had went to generic. So then the insurance would only pay for the generic, not for the on-label prescription. And if you wanted to get the on-label prescription, it was wildly more expensive. So that might be that, but if you want to give my staff your name, we can try to investigate what was happening there. Let me see, I'm just trying not to duplicate. Here's someone who said, and actually this might be a good question for our panel. I understand Montana has a new plan that covered everyone and saved a huge amount already. How does the Colorado plan compare? Can Colorado look at something like the Montana plan?
Montana is one of our states, and that is somewhat accurate. Back when the former governor Schweitzer was in office, he really wanted to do universal coverage. He, being so close to Canada, had seen what he called the Saskatchewan plan and how much money they had saved and how they were really helping all the population. So he actually developed a plan that's for the state employees. And so that's what so the state employees now have what would be considered universal healthcare. They have clinics, they have one in Helena, and they're building additional clinics where those state employees can go and get coverage. As far as Montana versus Colorado, Montana is going to have a marketplace very much like what we described here in Colorado. But they will continue to have private insurance and Medicaid and CHIP and other options, just as Colorado will as well.
Thank you. Okay, here's a question. Aren't more benefits available through Medicaid than Medicare?
It's a very similar benefit.
Yeah,
Long-term care.
it's a similar benefit. Yeah, Medicaid gives long-term care. And as those of you who have had relatives or friends who have needed long-term care know, then people have to be under a certain income level to get that. A lot of us would like to change that in Washington, but frankly, it is very, very expensive. Yeah.
A side note to that, it also depends upon the individual case, the individual, what the pre-existing condition is. So
Well, with that shouldn't be the case now, starting in 2014.
Right, but
So, yeah,
the benefits are similar, but it goes on an individual by individual basis.
right. Okay, here's a question. Why are you pushing Catholic and Christian businesses to provide birth control, hormones, and abortions? Let me say, first of all, that there is in the Affordable Care Act a conscience clause exception for people to have to buy birth control. What it has said, what the Obama administration has really tried to do is find a middle ground so that there would be available in every exchange. And I believe in the Colorado marketplace, there are plans available for individuals and small businesses to purchase that do not offer contraception, correct?
I'm sorry, I don't know.
Okay, I know the answer to this. The answer to this is yes, people can go in the exchange and buy plans that don't offer contraception because we mandated that. But for employers, contraception and family planning was one of the things that was required to be offered as part of the basic package. And if an employer is a religious institution, like a church, they would be exempt from it. But
No,
if an
that's
employer,
not- they're
please,
not.
let me finish my answer.
But
But
it's
if
not
an
true.
employer has many other employees that want to purchase insurance plans with their own money that offer contraception, then they will be allowed to do that, but there's an intermediary there so that the conscience of the employer would also be met. It was an attempt to have a middle ground, and I think that it was a very responsible attempt.
It's
So,
not so, if that's
I know
how-
you might disagree with me, but that was the attempt that was made.
Abortion,
There is no, you know what,
that's the issue.
you know what,
And
there
they have
is,
to go to court to fight it.
there is no abortion that is offered in
It's an
these
abortion
exchanges.
patient, and
If
that's an
somebody's
abortion.
private insurance plan offers all necessary medical services and they want to purchase that, then they can purchase that insurance plan. You know, I've got a stack of questions here. I'm trying to make sure I get all of the subject areas that people have asked that are general. Okay, that's the, okay, here's a question that hasn't been asked. How will CFNC, the Colorado Exchange, be reaching out to current uninsured to make sure they enroll? Also, are tax credits paid out even if the individual does not pay taxes?
So, the first one is how are we reaching out to the uninsured? And I would say through a lot of our assistance channels that I discussed, with health coverage guides that are working all around the state. That is their primary missions, is to figure out the people in their communities that are uninsured and reach out to them and help educate them about their options that are now available. We also are trying to, we have a huge campaign through how many of you have seen our advertisements we have spots on the radio and on TV channels and sporting events, and we're trying to really get it out there, and we're hoping that many people that are uninsured will hear about us through all those different channels too. So I think we're trying it on all fronts to get the word out and to provide assistance. The second question was about getting the tax credit for if people haven't filed taxes. And if they haven't in the past,
It's not having filed taxes, it's if you don't actually pay any taxes, you may.
If you're not paying tax.
oh,
Yeah.
yeah, then there would be, my understanding is it's that hardship exemption that we would have to look into with that person. Would you want to elaborate there?
Yeah, so in the first year, you can get a premium assistance even if you don't pay taxes, because a lot of that, the information is being verified by your tax returns and otherwise. In future years, even if you don't pay taxes, you need to file a tax form so that you can get that premium assistance. But in this first year, you don't need to.
And what we'll be asking is that you plan to file in that coverage year when you would be receiving the tax credit. So that's one question that we'll be asking.
You know, in my case, it's not the same, but I have solar tax credits, and because I'm on Social Security, for many years I haven't paid any taxes, which means I can't get the solar tax credit.
If you can work with my staff
No, I
or
mean,
with
I-
these representatives afterwards, we can help you get a better answer that's going to be more tailored to your personal situation. I've got a lot of the similar questions that are here. I'm only taking questions from cards.
Mine's on the front.
Okay. Let me get these two questions that I think kind of cover some of the answers. And then if I haven't answered your question, if you can please let us know your name if you didn't put it on your card, then we will get back and answer every question that was asked today in writing later. This question is, do tax credits only apply to those who purchase through exchanges, or does it apply to those who meet the criteria but continue to purchase elsewhere, for example, para?
Yeah, so people will have to purchase through the marketplace to get these tax
Yeah,
credits.
they don't get the tax credits otherwise. And the second question, the last question is anyone going to, there are two questions on this card. Is anyone going to reel in the drug company's excessive costs to us? I am here to say that and I actually said this in a hearing we had. Remember when they did the Medicare prescription drug Part D benefits in 2006? And I felt that the Secretary of HHS should be able to negotiate prescription drug benefits under Medicare, just like they do in the VA, just like your private insurance company does, all these other things. And I really didn't understand why we would pay hundreds of millions or billions of dollars more to prescription drug companies simply because, I mean, it's taxpayer money under Medicare. And so this is an interesting thing, which I told my colleagues, is even though I oppose that and I voted no on that bill, still it has helped millions of seniors be able to pay for their prescription drug costs. And so I'm continuing to argue that in the Affordable Care Act and in Medicare, we still should allow these government agencies, if they're using our taxpayer dollars, they should be able to negotiate prescription drug prices just like they do in private insurance. And I'm going to keep fighting for that. The last question is also a really good question. Why are the tax credits up to $49,500 in income for individuals, but only $62,000 for a couple? We could use a break. I don't know who asked that question, but I think that's an excellent question, and I'm going to go back and find out the answer to it because I don't have it right now. I want to.
I'll just pipe in there that it's actually whether you're a family of one or a family of two or four, it's actually the tax credits are dependent on someone's federal poverty level threshold, and you use the income and the household size to get to that threshold. And for tax credits, it's 133 to 400% of the federal poverty level. So it is actually whatever your family size is, we figure out that right threshold that you're at. So it's not different for a couple versus.
Good, well, you got your answer, thank you. I want to thank everybody for coming. If I didn't get to your question, please let us know and we'll respond in writing. And in addition, if there's, is there any, if anybody wants to talk about Syria, a couple of people have asked me. So if there's folks who don't want to talk about Syria, if you know, we'll just take a little break here for a minute, and you can go talk to the folks in the hall, or you can go home and enjoy the rest of your day. I'm just going to spend a few minutes kind of letting you know where I am because it's coming up. Is that okay with everybody?
Yeah.
Okay. Good. All right.